Welcome to Healthy Habits channel. Here we give you the latest and surest health facts as it relates to you. Today, we will be looking at 12 common symptoms never to ignore. Never. We've all ignored medical symptoms from time to time, usually without dire consequences. Let's face it, it's much easier to avoid the doctor than to go and be told that what you're secretly worried about is nothing. But there are some symptoms that should send you to your doctor without a moment's hesitation. Which health symptoms should always prompt a visit to your doctor's office or maybe even to the emergency room? Sometimes things happen in our bodies that seem minor and which we may be tempted to dismiss. However, some of these health warning signs should be evaluated by your healthcare provider so they can be effectively treated before they turn into more serious problems. In this new video, we'll be showing you 12 common symptoms never to ignore. Before we continue, make sure you subscribe and click on the notification bell so that you'll be notified whenever we upload a video. 1. Rapid unexplained weight loss. Having extra pounds melt off without even trying sounds like a dieter's dream come true. However, this can be a signal that something is going wrong in your body. If you rapidly lose 10 or more pounds for no apparent reason, no dietary change or new exercise program, your doctor needs to evaluate why. It could be a sign of physical or mental illness, such as depression, if it is accompanied by feelings of sadness or fatigue. 2. Chest pain or discomfort in the upper body. Unlike the movies, most people with heart attack don't suddenly fall to the ground clutching their chest. Symptoms often come slowly and people may describe an uncomfortable pressure, squeezing or pain in the center of the chest that lasts a few minutes or goes away and comes back again. Sometimes the symptoms are felt more in the neck or in the arm. Women may be more likely to experience symptoms such as nausea or vomiting, back or jaw pain, or shortness of breath. It is uncommon for people suffering from a heart attack to break out into a cold sweat. A heart attack is a circulatory problem and it is different from a cardiac arrest, although the two terms are sometimes mistakenly used interchangeably. In a cardiac arrest, a person is more likely to suddenly fall to the ground because the heart suddenly stops beating or starts beating abnormally. If you suspect someone is having a heart attack or has had a cardiac arrest, call your local emergency straight away. Minutes matter and fast action can save lives. 3. Intense and sudden headaches. Headaches can, of course, be self-inflicted, but sudden crippling headaches that stop you in your tracks could be a reason to be concerned and should not be ignored. They could well be one of a number of things, including meningitis, burst blood vessels in the brain, aneurysm, a cardiac self-phagia, or things that most definitely need immediate attention. If you have been suffering intense headaches which come out of the blue, then seek medical advice. If you start having headaches with regularity and if they come on suddenly, then call your doctor. Those could be the sign of brain tumor, problems with your eyesight, or a number of other factors. 4. Shortness of breath or wheezing. Many different conditions can affect your breathing. Although most causes are not dangerous and are easily treated, if the breathing difficulty is new or getting worse, it may be a sign of something more serious. Call the emergency services if somebody stops breathing, is having serious difficulty breathing, or if their breathing difficulty has come on suddenly. Urgent attention is also warranted in people with a known condition such as asthma, whose usual reliever medications such as Abdominal spray are not helping, or in people with chest discomfort accompanied by shortness of breath. 5. High or persistent fever. Most of us get fevers from time to time. Our bodies fight infection. However, if you have an exceptional high fever, 100 degrees Fahrenheit or more, or a fever that persists for at least 3 days, see your doctor. Fever also can be a symptom of severe upcoming disease, so contact your physician, especially if you have other symptoms like cough or headache. Night fevers accompanied by night sweats can be an early cancer warning sign, so report this to your doctor too. 6. Abdominal pain. See your doctor if you have severe or persistent abdominal pain, which can indicate serious health problems such as appendicitis, intestinal blockage, gallstones, and a host of other conditions. Other warning signs that mean it's time to see the doctor include diarrhea lasting more than 3 days, black, tarry stools, blood in your stool, and heartburn that persists or worsens even after you take medication for it. Bear in mind that how bad your pain is does not always reflect the seriousness of the condition causing the pain. For example, a stomach infection can cause severe stomach cramps, whereas colon cancer or early appendicitis may only cause mild pain or no pain. See your doctor if your abdominal pain persists or reoccurs. 7. Blood mixed with feces in the urine or non-menstrual bleeding. Blood occurring in places where or when it shouldn't is always a warning sign. Blood on or mixed into your stool can occur with hemorrhoids, anal fissures, stomach ulcers, inflammatory bowel disease, and colorectal cancer. Bright red blood usually indicates bleeding near the rectum, whereas dark or tar-like blood mixed with the stool indicates bleeding higher up in the colon or small bowel. Blood in the urine may turn toilet water red or pink. It may be a sign of kidney, urinary tract, or prostate problem, or occasionally the result of bleeding disorder. Bleeding in postmenopausal women or constant bleeding in women of childbearing age always warrants further investigation. Causes include fibroids, hormonal medications such as estrogens, inflammation or infection of the cervix, ectopic pregnancy, or cancer. 8. Major toothache. Having sensitive teeth is one thing, but if your teeth are setting you on edge on a frequent basis, then you really shouldn't ignore it. Painful toothache can indicate signs that your tooth nerves are exposed. If picked up early enough, the problem can be solved with a simple filling, whereas if left unchecked, you could end up with an infected nerve and be in need of costly root canal treatment. The simple answer is attend your dentist regularly, at least every 6 months, and seek attention as soon as you notice an obvious problem that can't just be dismissed as sensitivity. 9. Oversized fatigue. Everyone's energy level is different, especially as they age. But if you're finding that suddenly you can't maintain the pace of your life, then your body might be trying to tell you something. Your doctor can test you for anemia. You could have Lyme's disease or malignancy. Your hormones might be out of balance. It might be a sign of heart attack. In any case, don't ignore it. See your doctor and let him or her rule out the causes of your lethargy. It may be a simple problem that can be remedied. You will feel more like your old self in a very short time. 10. Skin changes. Your largest organ is your skin, and it can reflect the state of your health. If you notice your skin, especially your fingertips, has a yellow appearance, this can be a sign of jaundice, which can indicate possible liver or gallbladder problems. See your doctor if you have this symptom. Other skin changes you should never ignore include large, rapidly growing, bleeding, or otherwise unusual skin lesions or lumps, as well as suspicious changes to existing moles. Contact your primary care doctor or dermatologist to check out skin symptoms as soon as possible. 11. Tenderness, pain, or swelling in one or both legs. Almost all types of pain, swelling, or tenderness in the lower limbs needs to be investigated further by a doctor. However, causes vary greatly in urgency and severity. Generally, symptoms that come on suddenly occur just in one leg, or that are accompanied by chest pain, difficulty breathing, or confusion warrant a visit to the ED, as they may be a sign of blood clot such as DVT, meaning deep vein thrombosis, or a heart condition. If the swelling or pain has come on gradually, see your doctor as soon as you can. Common causes include arthritis, drug side effects, heart failure, injury, kidney problems, poor circulation, or pregnancy. 12. Changes to your breast or nipples. Breast cancer is the second most common cancer in American women behind skin cancer. This year, over 281,550 women are expected to be diagnosed with either invasive breast cancer or carcinoma in situ, the earliest form of breast cancer. Early detection is the key to survival, although there is some controversy regarding when screening should begin and how frequently it should take place. All women should be aware of the normal look and feel of their breast and report any changes to their doctor. Changes may include a lump, thickening or tenderness in or near a breast or an armpit, breast or nipple skin changes, ridges, dimpling, pitting, swelling, redness or scaling, nipple discharge, unusual breast tenderness or pain. Don't wait, act now. While nobody wants to get sick, it happens to all of us every now and then. The one thing all these symptoms have in common is that your chances of survival are greatly increased if you act quickly. Some things just can't wait until tomorrow or next week. See your doctor today. And hey guys, don't forget that the information contained in this video is meant to be helpful and educational, but is not a substitute for medical advice. Thank you for watching. Don't forget to hit the like button and to share with friends. Please subscribe and click on the notification bell if you wish to receive more videos from us. We love you.